This simple white powder is sitting in nearly every kitchen, yet most seniors have no idea what it's truly capable of. Backed by research from the Journal of Nephrology and the Journal of Clinical Dentistry, baking soda isn't just for cooking or cleaning. It's quietly reversing pain, detoxing kidneys, soothing arthritis, and helping seniors fight off 13 different health problems. So, why hasn't your doctor told you this yet? Stick with me, because once you learn how to use it correctly, everything changes. Most people reach for baking soda when they're baking cookies or scrubbing the sink. But what if I told you that same teaspoon could help your body flush out toxins, reduce internal acidity, and leave you feeling completely renewed? Baking soda, also known as sodium bicarbonate, transforms into a powerful alkaline solution when mixed with water. And here's where it gets fascinating. This alkalinity may support your body's natural ability to detox. Let's start with the outside. Seniors with sensitive skin, eczema, or chronic rashes often turn to expensive creams, but many are discovering that a warm baking soda bath, just a handful dissolved into the tub, can ease itching, calm inflammation, and gently pull impurities from the skin. The result? Smoother, soothed skin and a feeling of deep natural relief. The anecdotal evidence is overwhelming. But what about inside the body? Here's where science gets involved. According to a study published in the Journal of the American Society of Nephrology, baking soda supplementation was shown to slow the progression of chronic kidney disease by reducing acid buildup in the blood. That's not folklore. That's a clinical finding. In that study, patients who took sodium bicarbonate tablets had significantly better outcomes in kidney function compared to those who didn't. Why? Because high levels of acid in the blood, common in aging bodies, can tax your kidneys and make detoxification harder. Baking soda, in small supervised doses, helped restore balance. Some alternative health advocates even suggest that alkalizing the body using a mild baking soda solution may enhance the body's ability to eliminate environmental toxins, improve digestion, and balance pH levels in the blood and urine. While more studies are needed to make broad claims, there's promising support. Now, before you go chugging a glass of baking soda water, a word of caution. Moderation is key. The body is already highly skilled at regulating its pH, and overuse of baking soda can lead to serious health problems like high blood pressure, sodium overload, and alkalosis. Always talk to your doctor before beginning any internal use, especially if you have heart or kidney conditions. Still, when used carefully and under guidance, baking soda might just be the cheapest detox tool you've never used. It's time to stop seeing it as just a cleaning agent. Because when it comes to gently supporting your body's detoxification process, this humble powder could be the quiet powerhouse you've been missing. And we're only getting started. Let's talk about your smile. Not the one in your photo albums, but the one you see in the mirror each morning. Maybe a little dimmer than it used to be. Over time, coffee, tea, and everyday meals leave their mark. Whitening strips promise miracles, but for seniors with sensitive gums or thinning enamel, they can feel more like punishment than beauty treatments. But what if the secret to a brighter, healthier smile was already sitting in your kitchen? Baking soda's natural abrasiveness makes it an ideal solution for removing surface stains without the harsh chemicals. When you gently brush your teeth with a baking soda paste, you're not just scrubbing away discoloration. You're polishing each tooth like a gem. You might have even felt the difference. That ultra-smooth, squeaky clean feeling after brushing with baking soda? That's not your imagination. That's real physical cleansing in action. But here's where it gets even more interesting. Baking soda is alkaline, which means it neutralizes the acid in your mouth, the same acid that feeds harmful bacteria. These bacteria don't just cause cavities, they're the culprits behind gum disease, bad breath, and even systemic inflammation. By restoring a healthy pH in your mouth, Baking soda does more than clean. It protects. And it's not just folk wisdom, it's science. A study published in the Journal of Clinical Dentistry found that toothpaste containing baking soda significantly outperformed non-baking soda toothpaste in removing plaque and whitening teeth. Another study confirmed that baking soda reduced oral bacteria levels and improved overall oral hygiene in just a few weeks. And yet, this solution costs just pennies per use. But like anything powerful, it comes with a warning. Don't overdo it. Using baking soda too frequently or brushing too hard can wear down enamel over time. Experts recommend using it no more than 2 to 3 times per week, always with a soft bristle toothbrush and never in place of your regular fluoride toothpaste. Think of baking soda as a natural booster, not a daily driver. Used wisely, it enhances your smile without stripping it of what keeps it strong. So, the next time you notice stains creeping in, skip the $40 whitening strips. Reach for that little orange box instead, because a brighter smile, cleaner mouth, and fresher breath might just begin with something that costs less than your morning coffee. And we're just getting warmed up. Next, let's tackle one of the most irritating health complaints: heartburn. Let's face it, heartburn is more than a nuisance. It's the burn that creeps up your chest after a rich dinner, the acid that keeps you awake at 2 a.m., and the reason many seniors dread their favorite meals. That tight, fiery pressure behind your breastbone, that stomach acid flowing the wrong way, up into the esophagus. Irritating tissue never meant to handle it. But there's a simple, effective fix that's been hiding in your kitchen cabinet for decades, one that works fast, and it doesn't cost a dime over $1. Baking soda. Why? Because it's alkaline, and acid and alkali are mortal enemies. When that teaspoon of baking soda dissolves in water and enters your stomach, it neutralizes the acid causing the discomfort. This isn't just a home remedy passed down from your grandmother. It's a solution recognized by modern science. In fact, according to a review published in Gastroenterology and Hepatology, sodium bicarbonate is classified as a fast-acting antacid, capable of relieving occasional heartburn symptoms within minutes. That's right, it works faster than many over-the-counter medications. And here's the beauty of it. You don't need to wait in a pharmacy line or pay for expensive tablets. A glass of water, a half to 1 teaspoon of baking soda, and a gentle stir, and you've got one of the oldest and most reliable acid-fighting tonics ever used. It's especially useful for seniors, many of whom deal with acid reflux triggered by medications, slower digestion, or age-related changes in the digestive tract. But, and this is crucial, baking soda is not a long-term treatment for chronic acid reflux or GERD. If you're reaching for it daily, that's a sign to consult your doctor. There's also a sodium warning. Baking soda contains a high amount of sodium. If you're on a salt-restricted diet, have high blood pressure or kidney issues, using baking soda regularly could do more harm than good. Moderation is the key. Use it as an occasional fix, not a daily habit. And always remember, baking soda works by neutralizing, not by healing. It offers fast relief, not a cure. But for those sudden flare-ups, for that holiday dinner regret or the late-night chili mistake, it might be the fastest, cheapest relief on the planet. So the next time heartburn strikes, skip the panic and the purple pill. Reach for what's already in your pantry: a teaspoon, a glass of water, a deep breath, and feel the burn fade away. Up next, let's tackle a health issue that creeps up slowly but can cause endless discomfort: fungal infections. And yes, baking soda has something to say about that too. Fungal infections don't announce themselves like a heart attack or a sprained ankle. They creep in. First, it's just an itch, then a flaky patch, then maybe cracked skin between the toes or a red irritated area that just won't heal. For seniors, especially those with diabetes, limited mobility, or weakened immune systems, fungal infections like athlete's foot, ringworm, and candidiasis can become chronic, painful, and deeply frustrating. But what if your first line of defense wasn't in a plastic tube from the drugstore, but a powder in your pantry? That's right, baking soda. When applied topically, baking soda creates an alkaline environment, which disrupts the ideal conditions fungi need to thrive. Fungi love warm, moist, and acidic environments. But raise the pH, their microscopic little worlds fall apart. And this isn't just an old wives' tale. A study published in the journal Mycopathologia tested baking soda against various strains of fungus. The result: 80% of the fungal strains had their growth inhibited by a 10 gram per liter baking soda solution. Think about that. A treatment that's non-toxic, easily available, and scientifically supported, without the harsh side effects of chemical creams or sprays. Here's how seniors are using it. As a paste, mix baking soda with water and apply it to affected areas like toes, underarms, or skin folds. Leave for 10 to 15 minutes, then rinse. As a foot soak, add a few tablespoons to a warm foot bath and soak for 15-20 minutes. This not only targets fungi but also reduces odor, softens skin, and relieves discomfort. And for seniors dealing with recurring fungal nail infections or jock itch, this simple addition to your self-care routine could be a game changer. Even better, baking soda doesn't contain any steroids, parabens, or synthetic chemicals, making it a favorite among people with sensitive skin or allergies. That said, it's not a magic bullet. If your fungal infection is deep, persistent, or worsening, you should always consult a healthcare provider. And some people may experience mild irritation, so always do a patch test before applying it broadly. But for mild to moderate fungal problems, baking soda might be one of the most underrated natural remedies you've never tried. One box, one ingredient, multiple layers of relief. And next, we tackle a health issue that affects millions of older adults, especially women: urinary tract infections. Could baking soda really help here too? The answer might surprise you. If you've ever experienced a urinary tract infection, you know it's not just uncomfortable. It can be downright debilitating. Frequent urges, burning pain, that feeling of pressure, even after you've already emptied your bladder. For many seniors, especially women, UTIs aren't a once-in-a-while annoyance. They're a recurring nightmare that disrupts sleep, limits mobility, and even leads to dangerous complications like kidney infections or hospital visits. But what if there was something simple, safe, and inexpensive that could help bring relief? Yes, once again, baking soda steps into the spotlight. Here's the theory behind it. UTIs are often caused by bacteria that thrive in acidic environments. When you dissolve a small amount of baking soda in water and drink it, the mixture may help reduce the acidity of your urine, making the bladder less hospitable to bacterial growth. This isn't just folk medicine. A study published in the Japanese Journal of Urology followed 33 women with recurrent UTIs who were treated with sodium bicarbonate over 4 weeks. The results: most of the women reported decreased pain, less frequent urination, and overall improved comfort. And for those dealing with painful urination, this change in urine pH may also help reduce the burning sensation, making day-to-day life more manageable. Now let's be crystal clear. Baking soda is not a replacement for antibiotics, especially in cases of serious or persistent UTIs. But for seniors seeking gentle, natural support alongside traditional treatment, this remedy offers real promise. So how do you use it? A common approach is to mix 1/4 to 1/2 teaspoon of baking soda in a glass of water and sip slowly, once daily. This can help alkalize urine and relieve symptoms in early or mild cases. But again, always consult your doctor, especially if you have high blood pressure, heart conditions, or kidney issues, because baking soda is high in sodium. There's another important note. If your UTI symptoms worsen, if you notice blood in the urine, fever, or lower back pain, seek immediate medical attention. Baking soda can help ease discomfort, but it cannot fight bacterial infections on its own. Still, For millions of seniors looking for a gentle, science-supported way to take the edge off between doctor visits, baking soda may be the tool they never knew they had. One more health win from the powder that refuses to quit. And next we tackle something smaller, but just as painful. Ever had one of those tiny mouth sores that make talking and eating unbearable? In our next section, discover how baking soda might help you beat canker sores faster and gentler than over-the-counter gels. They may be small, but their pain is mighty. Canker sores, those painful little ulcers inside your mouth, can make it hard to eat, drink, talk, or even smile. And for seniors, they often come out of nowhere. A sharp piece of food, stress, dentures rubbing against the gums, and suddenly you're dealing with days of burning discomfort that over-the-counter gels barely touch. But once again, baking soda comes to the rescue, in the most unexpected way. Baking soda, or sodium bicarbonate, works to neutralize acid and restore balance to your mouth's pH level. And when it comes to canker sores, this is key, because the more acidic your mouth, the harder it is for ulcers to heal. That acid irritates the sore, inflames surrounding tissue, and creates the perfect breeding ground for bacteria. Now enter the solution, a simple rinse made with baking soda and warm water. This gentle mix not only soothes the sting but creates a less hostile environment, allowing the sore to begin healing faster, naturally. And yes, this isn't just anecdotal advice from a home remedy book. A study published in the Journal of the American Dental Association revealed that sodium bicarbonate mouth rinses significantly reduced pain and inflammation in patients suffering from recurrent canker sores. The study even found that baking soda helped control bacterial growth and supported faster healing compared to doing nothing at all. So what's the method? Take half a teaspoon of baking soda, dissolve it in a glass of warm water, and gently rinse your mouth 2 to 3 times a day. Swish slowly, focusing on the area of discomfort. Do not swallow the rinse. Just spit it out after about 30 seconds. The result? Less inflammation, reduced pain, faster healing, and best of all, no harsh chemicals. And because baking soda is non-toxic and naturally soothing, it's especially helpful for seniors with sensitive gums, dry mouth, or medication-related oral issues. But don't stop there. Baking soda can also help clean dentures and remove the microbial buildup that sometimes contributes to sores in the first place. Now, if your canker sores are large, recurring, or last more than 2 weeks, it's time to check in with your dentist or doctor. Sometimes they point to larger nutritional or immune-related issues. But for the everyday annoyance, the mouth ulcer that makes eating soup feel like fire, you already have what you need: a simple rinse, a teaspoon of white powder, relief from a tiny wound that steals your peace. And speaking of physical stress, what about the kind that builds up in your muscles? Up next, we'll reveal why athletes have been quietly using baking soda to boost endurance and how seniors might benefit from it too. Let's talk about movement. Whether it's walking upstairs, gardening, or simply getting out of a chair, muscle fatigue hits harder as we age. That heavy, aching burn in your legs or arms that makes you stop short, it's not just age. It's lactic acid building up during activity. And that acid is what causes muscles to tire out before you're ready to stop. But what if baking soda could help you keep going longer? A meta-analysis published in the Journal of Strength and Conditioning Research reviewed dozens of trials and found that sodium bicarbonate supplementation significantly improved performance in short-duration, high-intensity exercises like cycling, sprinting, and resistance training. And while this might sound like it's just for elite athletes, the implications for seniors are enormous. Because for you, performance isn't about winning a race. So how does it work? Here's the method many studies used. Mix 1 teaspoon of baking soda with a glass of water and drink it 60 to 90 minutes before exercise. The baking soda enters your bloodstream, raises the body's pH slightly, and acts as a shock absorber against the acid your muscles will produce during movement. The result? You may find you can push a little longer, recover faster, and experience less soreness the next day. But, like every other benefit we've discussed, this must be done with care. Too much baking soda can cause nausea, bloating, or diarrhea. It's also high in sodium, so those with heart disease, high blood pressure, or kidney issues should absolutely talk to their doctor before trying it. Start small. Listen to your body. But for those cleared by a physician, baking soda might be a simple, science-supported tool to improve daily mobility and reduce muscle strain. For millions of seniors, chronic kidney disease is a quiet storm. It doesn't scream, it doesn't hit all at once, but over time, it steals your energy, disrupts your blood pressure, weakens your bones, and can even lead to dialysis or kidney failure. Now imagine if something as basic as baking soda could help fight back. This isn't fiction. This isn't clickbait. This is real science, and it's changing how doctors think about kidney support. Let's break it down. As kidney function declines, the body struggles to eliminate acids from the blood. This leads to a condition called metabolic acidosis, where excess acid builds up and damages tissues over time. That acid overload stresses every part of the body, especially the kidneys themselves. But baking soda, or sodium bicarbonate, is an alkalizing compound. It neutralizes acid, and when used under medical supervision, it may help reduce the acid load in the bloodstream, potentially slowing the progression of kidney disease. One of the most important studies on this was published in the Journal of the American Society of Nephrology. Researchers followed patients with advanced kidney disease and metabolic acidosis. Half were given daily sodium bicarbonate tablets, while the other half weren't. The results? Those who took baking soda experienced significantly slower kidney function decline. They had a reduced risk of progressing to end-stage renal disease. Some even avoided dialysis altogether. It was a breakthrough. And it wasn't a $1 million drug. It was baking soda, used responsibly in controlled doses with medical oversight. But here's the catch. This is not a DIY remedy. Over-the-counter baking soda contains high sodium, which can be dangerous if you have high blood pressure, heart failure, or fluid retention issues. And using too much can lead to alkalosis, a dangerous shift in your body's acid-base balance. So the key is precision and supervision. Done right, baking soda may act like a shield for your kidneys, slowing damage, reducing acid stress, and giving your body more time to thrive. If you suffer from arthritis, you know the pain isn't just physical, it's emotional. The ache in your fingers as you tie your shoes, the stiffness in your knees that turns every staircase into a mountain, the swelling in your joints that steals your energy and independence. Over time, it can feel like inflammation is controlling your life. But what if your kitchen held a simple way to fight back? We've seen baking soda help with heartburn, kidney function, even athletic endurance. But now, scientists are exploring an even deeper impact: its ability to influence the immune system itself. Because arthritis, particularly rheumatoid arthritis, isn't just about wear and tear. It's about chronic inflammation, driven by an overactive immune response that mistakenly attacks your own joints. But baking soda may be able to help shift that immune response. A groundbreaking study published in the Journal of Immunology found that when animals and humans consumed baking soda diluted in water, their immune systems produced more anti-inflammatory cells and fewer inflammatory ones. Translation: the body's natural defense system calmed down. This was more than symptom relief. It was a measurable shift in immune behavior. Researchers discovered that baking soda seemed to encourage the spleen to stop overreacting, reducing the production of cells that contribute to inflammation and joint damage. Of course, this isn't a replacement for medication or physical therapy, and not all arthritis is the same. Rheumatoid arthritis, osteoarthritis, gout, each requires a unique approach. But if you're cleared by your doctor, trying a baking soda tonic, half a teaspoon in a glass of water once a day, could become part of a holistic approach to joint health. Just remember, moderation is essential. High sodium intake can affect blood pressure and kidney function, so never start this without medical guidance. Still, the idea that a household staple might reduce the immune fire behind arthritis? That's powerful. That's hope. If you've ever woken up in the middle of the night to a sudden stabbing pain in your big toe, you already know the cruel surprise of gout. It's not just joint pain. It's fire, swelling, and tenderness so intense that even the pressure of a bedsheet can feel unbearable. For many seniors, gout is a recurring nightmare, unpredictable, agonizing, and emotionally draining. And at the root of it all, uric acid. A study published in Arthritis and Rheumatism observed that patients who took baking soda during gout flare-ups experienced a reduction in joint inflammation and faster relief from pain. Why? Because lowering uric acid in the blood reduces the fuel for gout attacks. Even better? Many patients reported feeling less stiff and more mobile after incorporating mild supervised baking soda use into their routine. Here's how some people use it. Mix half a teaspoon of baking soda in a full glass of water. Drink it once or twice daily at the first sign of a flare-up. Stay hydrated throughout the day to help flush uric acid through the kidneys. But, and this is vital, baking soda is not a cure. It's not a substitute for medications like allopurinol or colchicine, and it should never be used without medical approval, especially if you have kidney problems, heart conditions, or high blood pressure, due to its high sodium content. Also important, diet and lifestyle still matter. Avoiding purine-rich foods like red meat, shellfish, and alcohol is essential in managing gout long-term. Baking soda might offer short-term relief, but not if your overall habits keep uric acid levels high. So now you know, this humble white powder isn't just for baking cookies or scrubbing sinks. It's a detoxifier, a healer, a fighter of inflammation, odor, acid, and pain. And yet, we've only scratched the surface, because new research is uncovering even more uses for baking soda, from balancing gut health to potentially easing autoimmune flare-ups. And some of the most surprising discoveries? They're not even about baking soda alone, but what happens when it's combined with other everyday ingredients. What if your morning routine could protect your joints? What if a nightly soak could restore your energy levels? And what if everything you thought you knew about common home remedies was just the beginning? The answers aren't in the pharmacy. They're in your pantry. And in the next video, we're going even deeper. We'll show you the overlooked natural combinations that could supercharge your health after 60, and how seniors around the world are using them to regain strength, mobility, and confidence. Click now to keep going. Your health journey isn't ending. It's just getting started.